One of the things I'm excited about is the new brand. Loughborough Dentistry is undergoing some changes into LUF Dental. And what we've done with LUF Dental is organize things in such a way that with the acronym LUF, we explain who we are and how we take care of you. L is look, the U is understand, and the F is fixed. And those three words take care of summarizing everything that we do for a patient when we're seeing you here in the office. We're finally labeling it in such a way that we can describe it better. Every patient that comes in, we're going to begin with look. And what does look stand for? It could be the exam. It could be x-rays. It could be how we look at your face and how you're responding to your smile. The next is understanding. We try our best to understand what your needs and wants are, understand your dental insurance and what the capacity of that is and how that can help you, and how that all fits into what your financial restraints are. So the understanding aspect is very important. So first, in review, we look at things, we examine you, we take x-rays, then we take that information and begin to understand better about who you are and how we can take care of you. And then we follow that with fix. Fix is a short word that encompasses a lot of things. It could be that we get rid of all your decay in your mouth and do fillings. We do crown and bridge to make your teeth stronger. We do cosmetic veneers to make your smile better. We help take care of your periodontal disease. So those are things that we can do in the fix section. So look, understand, and fix. You need to make a connection and get to know the patient. Their experiences are unique and different than anyone else's in the world. So what we have to do is customize our treatment to their needs, their wants, and their desires. Building a relationship, I think, is the best part of being a dentist, dealing with the people.